Today I'll be talking on the role of isokenetic testing post our ACL recons. So let's understand what is isokenetic testing. So it is supposed to be proven to be the single best method to objectively assess dynamic muscle performance. As the name suggests, it helps us to assess strength isokinetically, which is at a constant speed, but also we can assess strength isometrically and isotonically. There are over 25 companies worldwide that manufacture these machines. We at HN have been using the Primus successively for over 10 years. Let's understand why. So the first reason is it helps us to quantify strength of the hamstring and quads. Serial testing can help us to compare these values for the athlete. And lastly, as we know, ACL is a long-drawn rehab process, so it keeps the athlete motivated to keep pushing towards return to sport. The second reason is it helps us therapists to use a test, don't guess approach. And it can provide us specificity to our rehab programming so that we can really work on the deficits and really have a very targeted approach with a good reasoning behind it. The third reason is that now we all know it's also an important criteria to tick off for return to sport. According to this study, we need a quadriceps strength of a value of at least 90% to the non-injured side, which if not achieved can lead to 4 times greater risk of injury. So now let's understand the why. I usually put my patients on the isokinetic machine for the first time on 8 weeks, where I do a very plain, simple, vanilla isometric test. This gives me a gross understanding of the strength. At 14 weeks, I do a detailed isokinetic test, and I follow that up every 6 weeks until I reach a strength deficit of less than 10%. I have a small tick box that I like to tick off before I put them on. First is I need full extension, minimal or no swelling, good gait coordination, pain-free walking, and active flexion of more than 120 degrees. These are the 6 parameters that I assess, the first 2 being isometric, quadricep and hamstring at 45 degrees, concentric eccentric quads and hams at a speed of 60 degrees per second, isokinetically, as it is said that this speed is one of the ideal speeds to assess. So now that we have all this data, how do we make sense of it? First is that, again, simple, we can compare these 6 parameters to the non-injured side and try and reach a goal of less than 10% deficit. But we also have some ratios. The conventional ratio is the traditional ratio we all have heard about, that we do concentric hams to concentric quads, that is 2/3. It was Tiedel et al. Who first came up with this ratio, and he said that if we can maintain it to 0.66, it's an ideal situation for the knee to function. Later, Heiser et al. Came up with a study that said that if they started keeping an eye on the conventional ratio, and they saw that they could reduce the number of injuries in university soccer players. Now, the third ratio, and my favorite, is the dynamic control ratio. We noticed that in the conventional ratio, it's a good ratio, but it doesn't take into account eccentric hamstrings. And we know that eccentric hamstrings is the one that helps to counterforce the concentric quads during limb deceleration, while knee extension to prevent the anterior translation of the tibia. So this ratio takes into consideration that. Agar et al. Used this ratio for the first time to prevent injuries and said that a ratio of about 1 is ideal. I have a few videos that I'd shot to show you all. So this is isometric, which is plain and simple 45 degrees quads. And then we have the isometric hams, which is also quite simple and straightforward. The interesting one would be this, which is your concentric eccentric quads. I don't think there's any volume. So basically, what we're trying to do here is push up, and then when the lever takes the limb down, you still push up. So we get the concentric and eccentric quads. And likewise, for the hamstring, starting at a higher angle, going down, pull, and then when the lever takes you up, we still keep pulling. So this is how a report looks like. In this case, it's the hamstring flexion, that is a hamstring concentric eccentric for both sides. Considering the left side as the affected side, the value of importance would be this, which is your eccentric hamstring, say 2.202, and then this is your quads concentric eccentric, value of importance for the left side. And considering this patient, it's a good ratio because it's coming up to a 1.1. This is how a report for an isometric would look like. which is, again, a simple bar graft. So the take home from my side is, it is an efficient way to objectively calculate muscle strength. Please ensure testing of all ACL recons before return to sport at least, to ensure strength deficit of less than 10% and a dynamic control ratio of more than 1 to maintain good knee stability. Thank you.